Hi, my name is Priyanka Patel, and I'm going to be your pharmacist today. Are you Mrs. Williams?
Mm-hmm.
Okay, can I get a date of birth and address, please?
3/1/1976
Okay.
and 311 Shady Grove Road.
Okay. Do you have a moment where I can talk to you about your medication? I see here that this is a new medication. I would really like to answer any questions that you may have.
Sure.
Okay. Before we get started, do you have any allergies?
I'm allergic to codeine.
Okay.
It gives me a bad rash.
What about any other medications that you're taking?
I'm taking hydrochlorothiazide.
Okay. Do you take any OTCs or whole vitamins, anything like that?
I take Tylenol every once in a while.
Okay. Well, I see that Dr. Thomas has prescribed you sertraline. It's in 50 milligrams. It's also known as Zoloft, 50 milligrams. Have you taken this medication before?
No, I have not.
Okay. What did Dr. Sauls tell you this medication was for?
It's for my depression symptoms.
That's correct. It's commonly used to treat depression and anxiety. How have you been told to take this medication?
I really don't remember.
Okay, so I would strongly suggest that you take it once a day, and I would suggest that you take it at the same time every day. This bottle right here should last you about 30 days because it's a 30-day supply, and you have 2 more refills on this. So your prescription is good for 3 months. Okay? Have you ever had any trouble taking your medication in the past?
Every once in a while, I forget.
Gotcha. So some techniques that might help you include like having a pill box or writing in a journal or something like that, because that helps a lot of my patients stay on track with their medications. Just in case you miss a dose, do you know what to do?
No.
Take it as soon as you remember it if it's close to the dose that you normally take, the time that you normally take, but wait until the next dose if it's closer to the next dose time. Okay, to make sure your medication is working and making you feel better, some things that you can do is have a smile calendar system, or you can write in a journal.
What's a smile calendar?
Okay, so what you can do is you can write like a smiley face on the date on the calendar if you felt good that day, or if you didn't feel as good, just put a frowny face. If you felt okay and it wasn't as great, it was neutral, then just put a line with a dash, smiley face with a dash on it. And it just helps you keep track of how your mood was that day. So at the end of your therapy, you can go and talk to your doctor about what exactly you felt. Right. Where do you usually keep your medications?
In the kitchen.
Okay, I would strongly suggest that you keep it away from heat and moisture. So places like the kitchen and the bathroom are not a very good idea. I would suggest that you keep it at your bedtime table or maybe in a cabinet somewhere that, doesn't have any heat or moisture. What did Dr. Thomas tell you to expect from this medication?
Some sleepiness.
Right. So this medication may cause some fatigue. It may cause dizziness, nausea, but usually if you take it as I just told you to, it won't cause all that. Another common thing to keep in mind is to avoid grapefruit juice and alcohol because those may increase the risk of these side effects occurring. Do you have any other concerns and questions for me?
I do have a question, and it's about like my mother has told me about going the more natural herbal route.
Right.
And from a background where people do that a lot. Mm-hmm. And so I'm thinking about taking St. John's wort instead. Do you know anything about it?
Yes, ma'am. And I get this question a lot because I understand, people's concerns about the side effects and stuff like that. However, in this case, I would strongly recommend that you don't take St. John's worts and take this medication instead, just because St. John's worts interacts with so many things. It interacts with like every other medication out there, and it has a lot of side effects associated with it. So I would strongly urge you to consider that. And if, this therapy doesn't work for you, at the end of your therapy, we can try and discuss another route that we can take, but I would strongly recommend that St. John's worts, not be the first thing that you try. Okay, just to make sure that I didn't miss anything, do you mind repeating how you're going to take the medication?
I'm going to take it every day, and I'm going to try to keep it next to my bedside, so that it's out of the kitchen.
Right. What are you going to try to avoid when you're taking this medication?
I'm going to avoid alcohol and grapefruit juice.
Right. Some things that may help this medication work better is just exercising, watching your diet. They will, increase your adherence to the medication, and it will help the medication work better. Here's just some more information about this medication if you need it. feel free to call us anytime if you have any questions at all. Do you have any other questions?
No.
All right. Thank you so much for your time.
Thank you.